Hello, William and Mary, and welcome to our first community conversation of 2022. Thank you for joining us. I know that many folks tuning in may be new to these conversations, new families and students, new faculty and staff, and we're really excited to welcome everyone back to campus for a new semester. We also recognize that this is an anxious time for many of us, with Omicron cases surging around the country, and with so much to worry about, so much weariness this spring, whether it's worry about health or about jobs or about caregiving for family members and about what the next phase of pandemic is going to bring. So we expect that everyone listening is grappling with these worries. And with the pandemic constantly evolving at William & Mary, we use these community conversations to share concrete answers to the questions that we're hearing regularly and to help lower uncertainty where we can to mitigate those burdens. We find that especially helpful to do at the beginning of the semester as a way to update faculty, staff, and students, especially about how William & Mary is navigating pandemic. So we typically gather just a few experts together to speak directly to the issues that the community is raising at the moment, i.e. in the last couple of weeks, and we organize our conversation around those issues. I'm going to begin with an overview, and then I'm going to introduce our panelists and ask them to update us on the public health picture at William & Mary. Then we'll talk through the most common questions that we've been getting, and we'll close with a lightning round so that we can answer as many questions as possible. Since so many of us are new this semester, I'm going to start with a quick overview of how William & Mary makes decisions about our COVID-19 policies and practices. And I'm going to give you 6 basic principles that have evolved over the last 20 months and that have served us very well so far. The first is that we have a simple set of goals that we ask everyone to support actively. The goals are to keep teaching, to keep learning, to keep generating new knowledge, to keep our community as safe as possible with the tools that we have so that we can keep our students on track to their degrees. So very simple to say, very difficult to achieve, and we are all in for those goals. As we've learned, a primarily in-person experience is what students want and need. That's crucial for student learning, for a sense of community, for mental health, and so much more that we think matters at William & Mary. Staff and faculty want that fellowship too. And so the second thing to know is that we make our decisions in a phased way so that we can use the best data that we have at the moment. And that way we can make the best decisions that are possible under the circumstances. That way we can adjust as we keep going. We ask that the whole community be ready for those adjustments. We're constantly assessing which tools are best to help us now. I'll give you an example. Last semester, we began without pre-arrival testing because we saw that the ambient positivity rates were so low. But it turned out that pre-arrival testing was a really helpful thing. We saw a surge, as we always do at the beginning of the semesters, and that surge would have been lower. So we did pre-arrival testing this semester. The third principle is that we adapt with a great deal of intentionality and care, and we've gotten really good at that. The fourth is it's critical to remember that we're all in the same storm, but we're not all in the same boat. Some are much more vulnerable than others, and the more dynamic the phase of COVID that we're in, the more flexibility is needed. The next few months are going to require a lot of flexibility of all of us, and we're going to be talking about that in today's conversation in more detail. The fifth principle is that every semester is different. What worked last semester or last week or last month may not work this semester or this week or this month. We have a lot of humility. We may not get everything right, but we will do our level best to keep adjusting as we get new information and use the best tools that we have for the circumstances that we're facing. We know, here's what we can know, this semester will be different. From a vaccination standpoint and a culture standpoint, we are at a very strong place at William & Mary as we start this semester. We have a very experienced faculty and staff that are good at what they do. And we trust those experts on the ground to teach and to support students in the ways that they can, given the circumstances. We have different variants, Omicron and Delta. We had different directives from the federal government, from the CDC, and from the governor. We have a much expanded toolkit for addressing the pandemic and the disease itself, including better treatments that are coming online, evolving vaccines and boosters, and much more. We also have clarity about which masks matter and the ability to be flexible in the short term for students, employees, and others. And we expect a surge of cases, as we have seen at the start of every semester. Given the positivity rates in Virginia and around the country, we anticipate that those surges may be larger than in semesters past, and we have good strategies for addressing that. So the last principle, number 6, is that we will continue to communicate steadily as things change. Our aim is to equip you all with the tools that you need to help keep yourself and the rest of the community as healthy as possible, so you can keep teaching and keep learning, keep working. Our dashboard is going to be up soon. From the start of pandemic, our goal has been to turn the rules into habits. Shared values and shared culture are the key to that, and we've been incredibly successful so far. So thank you for joining us in that effort. So I am also grateful to be joined today by the members of William & Mary's multidisciplinary public health advisory team, 3 of the members to be exact. It's a pretty large team. Amy Sebring, who is our COO and COVID director, Dr. Virginia Wells, Chief Medical Officer in Athletics and infectious disease expert, and Professor Carrie Dolan, who is a professor of kinesiology and an epidemiologist. FAT, as we call it, the Public Health Advisory Team, is a team of university physicians and scientists, IT, student affairs staff, and administrators. So there's a lot of diverse expertise in the group. It meets very, very frequently to assess the latest data and the trends locally and nationally, and recommend best practices. So I want to thank the 3 of you and the rest of the team who are not here for working so tirelessly for William & Mary. All right, let me work through the questions collected from the community this week. We've got 4 categories. Where are we now at William & Mary? What does the science and the data tell us about this new phase of pandemic? What are the critical tools we can use to help mitigate spread? And what should students, faculty, and staff expect in a residential learning community this spring? All right, those are our topics. Let me go quickly to the first set of questions. And Professor Dolan, I'm going to direct the first one to you. These are about the broader picture of pandemic response at William & Mary and plans for the spring. I'm going to start with the word normal and say that we find ourselves now at a moment in which COVID-19 is beginning to become endemic. I want to stress become, because I know that we're not there yet. And I constantly find myself saying to folks, don't ask what the new normal is going to be, though I know the impulse behind that. But it's really, really hard to know what the new normal will be, because we are still evolving in the pandemic and in what we know works. And we still are waiting for new changes to come down the pike. So what can we expect in this transition? Professor Dolan, what can you tell us about that?
So first, I just want to recognize that it's normal to be stressed or be anxious or even have some grief, as we've all watched the COVID cases increase over the last few weeks. And I really want to use this time to focus on the broader picture of pandemic response and then our concrete plans for the spring. So I will be so excited when we can think of COVID just like a routine illness, but we just aren't there quite yet. Last semester, my colleague and fellow epidemiologist Iyabo Obasanjo and I spent a lot of time in our blog really thinking about how cultures emerge from a pandemic. And I am confident that as a William & Mary community, we will get there. Until we're there, we're going to continue to rely on what works. And what works will allow us to continue to convene safely and accomplish our goal of being able to educate some of the brightest minds. So we've got 3 big things. We have vaccines, we have boosters, and we have indoor masking. And all three of these things work together to help decrease and minimize the transmission as well as the severity of disease. I want to take a second to think about the boosters. So research has been showing us that over time, the immune response declines. And we have some good news. Boosters are doing what they are expected to do. They're boosting up the immune system. So we really need those boosters at William & Mary because we have a lot of students that are living in congregate housing. And if we're going to avoid severe illness in our campus community, we can use those as one of our tools to stay together safely. William & Mary has been very successful at staying flexible and adaptable in the way that we are learning and the way that we're working. And I know I'm focusing a lot on how I'm supporting and understanding the people that I work with. We're all showing up with different levels of comfort, and I'm thinking about that daily. So the other thing that I am doing is I'm planning smartly. I'm really thinking about disruptions in the workplace and then also disruptions in my teaching, and I'm making contingency plans for that.
I'm going to pick up right there where you landed there on the contingency planning and direct it to Amy Sebring. Amy, so we have a highly vaccinated and boosted population. We have a really deep commitment to mask wearing. I'll just remind folks who are here that in a study by the CDC last spring, over 10 weeks, with over 500 observations around campus, they observed nearly 100% mask wearing among students. So really strong commitment to make that rule a habit indoors. We also have a fantastic campus that makes working outdoors and playing outdoors and socializing outdoors, eating outdoors in most of the year, really an easy and wonderful thing to do. Given these conditions, Amy, what else should students and faculty and staff be thinking about? What are the other contingencies and plans and strategies we can use to minimize the spread of COVID this semester?
So maybe I'll start actually with your comment around culture, because that has been so important to our success. And one of the things we've also seen is actually that we lapse a little bit in between semesters. We go back visiting with family or friends, maybe taking a little bit of time off work. And so it is really important as we enter into the next semester to kind of reset and make sure that we are working collectively together to ensure that we're navigating successfully through this semester. One of the tools that I think has been consistently effective, but is going to be really important to us as we go into the spring, is having students and employees routinely go to reportcovid.wn.edu as they either are experiencing symptoms or recognize that they may have been a close contact. That process gets us to a point where we can assign a case manager to you, and that case manager can help answer your questions, can help you get testing at the appropriate time, and help navigate quarantine and isolation if you need to do that. Many of our students are already familiar with that process, but again, it's an important process for faculty and staff too. As we see Omicron spreading and understand that it is going to be with us, being able to reach out and have those resources, I think, are going to be important to us in navigating going forward. Also, given the difficulty of finding tests in the community, we've shifted the semester in a way to help our staff and faculty also have access to testing as well as students. I know there was some confusion early on last semester for students in finding testing. And in previous semesters, we've actually said to faculty and staff, we've referred them to their physician or their local healthcare provider. We recognize in this moment in time that finding tests is a challenge, and reportcovid.wn.edu, we can help connect you with the tests that you need. I can go on, Madam President, or if you want me to pause there, we can.
I'm just going to add one thing, which is about testing at the right time.
Yes.
Can you talk about why case managers matter in that?
So very importantly, and I may rely on Dr. Wells to weigh in a little bit here, but part of the process, if you test too soon as a close contact, you may get a false negative. And so we really want to make sure that people, one, aren't wasting tests if they aren't needed, but also that they're testing at the right time so they can have more confidence in the test results that they're getting.
That's perfect. We'll come back to that as we need to. And I know you wrote about that to the campus yesterday in your COVID update, I want to ask about one other thing that you mentioned in the COVID update, which is the executive directive from Governor Youngkin restricting vaccine mandates for state employees in the executive branch, which includes higher education. You referenced that, and for anyone who's not seen that yet, can you explain the impact of that executive directive on William and Mary's protocols?
Yep, absolutely. So first, maybe let me start with a few statistics, just to kind of frame the conversation and the impact as we think about the semester ahead. So currently more than 96% of our students who will be on campus this semester are fully vaccinated. And as of Tuesday, almost 82% had already reported receiving a booster. So as a reminder, yesterday was our deadline for students to upload proof of booster, and we are still working through with students who have not yet reported and expect that that number is going to continue to rise this week. So snapshot, those are still a work in process. For everybody that's gone through the upload process, you'll see that there's a preliminary phase, and we'll have more solid numbers by the end of the week. But regardless, we have a highly vaccinated student population, a highly boosted population, and we expect we'll bring the rest of the student population into compliance over the next few days. For employees, we've got almost 95% of our employees vaccinated. And again, as of yesterday, over 75% who reported that they've already received a booster. On January 15th, as you referenced, Madam President, Governor Glenn Youngkin signed Executive Directive 2, announcing a change in public policy guidance for state employees that prohibited vaccines as a requirement for employment. So given that change and consistent with that executive order, William and Mary announced yesterday that we are moving to strongly recommending vaccines and boosters for all employees. Although they're no longer required, the research continues to show that the best way to protect yourself is to be vaccinated and boosted as soon as you're eligible. Executive Directive 2 goes further and also says that mandatory disclosure of vaccine status is also prohibited. So going forward, William and Mary will no longer require that, although we do ask employees if they are willing to provide information on their vaccination status, so that can help inform our testing response and quarantine and isolation should you need it.
So just to clarify, we ask for vaccine status in case management. When we don't know vaccine status, we have to default to the longest quarantine and isolation phases possible. Is that right?
That's right. So the current guidance is that if you are not fully boosted, that you need to quarantine if you've been in close contact. So if we don't know what your vaccination status is, we have to assume that you need to quarantine if you've been in close contact. If you've been able to verify that status, we're able to work through with you and make sure that as long as you remain asymptomatic, that you don't have to quarantine initially. Obviously, if you develop symptoms or test positive after 5 days, you would move into isolation. But if we don't know your status, it's really hard to advise, and we do have to assume that you need to quarantine and isolate for the longest period possible if your status is unknown.
All right, then. Thanks for that clarification. I'm going to take this next question to Dr. Wells. The CDC has also changed guidelines, and with the changes that we're seeing, I know it's incredibly confusing. We are working fast every week to keep track of the shifts. So to minimize confusion, could you just walk through what a student or an employee needs to do if they know they're exposed or if they discover they're positive? Just
Absolutely.
concretely. Yeah.
Absolutely. And it's important for our staff as well as our students to know that they do not have to navigate COVID alone. We do have resources available to our staff and faculty as well as our students. And the first thing that any staff member or student has to do if they think they have been exposed to COVID, or if they believe that they, or if they do have COVID, is to report COVID. And we do have a website in order for them to report, and that will trigger immediately access to a case manager who will help them to navigate COVID. Any individual who believes they have been exposed will then be instructed If they are unvaccinated, then they will need to quarantine for at least a period of 5 days, and they will then test on day 5. For those individuals who are vaccinated and boosted, they will not need to quarantine. However, they will still need to test on day 5. So testing is necessary for any individual who is exposed on day 5. The only difference is the quarantine portion, and the case manager will walk them through that and guide them through that process. If you test positive, then you will be instructed to immediately isolate, and that is important differentiation. Quarantine is different in that you are monitoring for symptoms. If you test positive, you are strictly isolating, which is protecting those around you from infection. And the case management process works very well and helps. There's constant communication with both the student and the staff member to help process this information. So it really helps, because I do know it's a moving target. It's very confusing. And our case management folks are in contact with both the physicians on staff here to help them to navigate any changing environment. And if there are questions that either the staff member or the student has, then we can help to process that information.
Thanks, Dr. Wells, for walking us through that. That's actually really helpful. Let me ask for one clarification. I know that William & Mary is required by law to ensure that employees do isolate or quarantine as appropriate, and that depends on vaccine status. So does it matter what your vaccine status is, what you tell us? How do we handle that?
Absolutely. It is a requirement through the Virginia Department of Health that appropriate isolation and quarantine is taking place in the event of an exposure and in the event of a positive case. So we do need to know your vaccine status so that we can instruct you properly on the appropriate steps to take if you are a close contact. So knowing your vaccine status does help us to guide you correctly in that process.
And then if we don't know vaccine status, we'll default to unvaccinated, which means the longer quarantine and then isolation.
Absolutely. Well, we would have to default to the unvaccinated state, which means you have to quarantine. As individuals who are vaccinated and boosted are not required to quarantine, just to monitor for symptoms and test, which is very different.
Okay, thanks for keeping that clear. Much appreciated.
Yes. Mm-hmm.
I'm going to go back to Professor Dolan and ask Carrie. This is a question that I have heard a lot. Does Omicron affect the tipping point at which the university will resort to remote learning? And have we considered that?
So we never rule out any options, but I think it's important to remember that William & Mary has been in person since August of 2020. I recently had a friend send me a picture of that summer where she was spraying down her groceries in the garage, and that really struck home the message of where we were at that time, and that's so different than where we are right now. That summer, we knew so little about COVID. We were just starting to learn how to test for COVID, and we certainly didn't have any vaccines. We are now in a much different place with a lot of tools. We have these powerful vaccines and boosters. We know a lot about masks and which ones work the best. And this is our 5th semester that we've navigated this pandemic. So we really have a lot to build on in terms of both internal and external knowledge about how to navigate this successfully. We are in a population that is highly boosted and highly vaccinated. And so it makes a safer community than many other public spaces. That being said, I think it's important that we remember that we have to be flexible, we have to be open-minded, and we have to be intentional, because we are continuing to monitor the data and the science we had, including our COVID-19 trends locally.
That's super helpful. I will just emphasize to the whole community that convening is crucial to our mission. We believe in being in person. We believe it really matters. We know, especially in an educational setting with faculty and staff and students working together, as we do at William & Mary, that fellowship is one of our superpowers. There's also a real cost when employees and teams are not in person, when classes are not in person. Learning is a social activity. I know every educator knows this. We've learned it as we've learned our craft. And we have had a powerful lesson in how true it is as we've gone through the last 20 months. So learning is a social activity. People learn best in company with others. And that means at William & Mary, a semester that's going to require flexibility and compassion and understanding. We know there will be significant disruption. We know teams will be shorthanded at times across the university. We ask all faculty and all students, all staff, to be understanding with each other, to know that a lot of people are stepping in to sub for somebody as they're getting better, as they're caring for somebody who's not well. And I'll add flexibility and adaptability to our William & Mary superpowers. And thank you for that in advance. So I'm going to go to the lightning round now. We've got a number of questions. I'm going to ask that you all answer them as quickly as you can. First to Amy and then to Carrie. What about masks? Can we offer them to the community?
Yes, we've ordered 40,000 KN95s. So those are, a portion of those have already arrived. We're expecting the rest in the coming days. So we absolutely will have access for students, faculty, and staff to KN95s. I also would say, although 40,000 sounds like a big number, given the size of our population, I really want to encourage individuals to make sure they're keeping a personal supply of masks as well. The nice thing about KN95s is that you can use them more than once, but over the course of the semester, we'll want to make sure that everybody is continuing to draw on new masks when their old ones are wearing out.
That's really great.
I love my bling masks and I love my William & Mary logo masks. So can I use them? What do you think?
So Carrie, I'm going to turn that one over to you. I know you've spent a fair amount of time thinking about and testing masks and understanding the pros and cons.
Yeah, so I'm really excited about the 40,000 masks. Mine have been on back order for about 3 weeks. So that's great news. I really think, the most important thing that we think about is just remembering to wear them inside and around other people, regardless. Some masks do offer more protection than others. So those N95s and the KN95s are going to offer the most protection because what they're doing is filtering up to 95% of the particles in the air. What I'm telling my friends and family is that what's most important is that you're wearing the most protective mask that you can get that fits you really well and that you're wearing consistently.
Okay, I guess I'm putting my green and gold mask aside. Bummer, but it's great to know the science behind it. Thank you for that. These are questions for Amy and Virginia. COVID tests have been hard to come by. Amy, can you just say a little bit more about the tests available at William & Mary this semester?
So, we've been anticipating for weeks that, we would likely need more tests available for symptomatic individuals and close contacts. And so with that, we've structured at least our supply and our ordering to be able to provide, as I mentioned earlier, consistent testing for students if they are positive or believe they're a close contact, as well as employees. And that is a shift from last semester, but we do know that testing is going to be a really important tool in the arsenal this semester, and also have heard directly from faculty and staff frustrations about being able to get tested in the community.
Yeah, right now. Dr. Wells, just staying on testing for a quick second. We've got a question about plans for regular student testing this semester. Are census testing or wastewater testing or random testing appropriate now?
I don't think so. Just to reiterate what you said in your opening remarks, President Rowe, that we found that pre-arrival testing makes sense as our students are traveling back to campus from faraway places, from across the state, from across the country, from out of the country, that it's important to know what our population's status is upon arrival. So having a negative test upon arrival protects our community. While we know our community is not a closed community, it is essentially a community that stays pretty much on campus in this area. And so having an idea of negative test upon arrival is very important. Knowing that we have a highly vaccinated and boosted population is helpful indeed. So what we're going to do going forward is really focusing on testing our symptomatic individuals, our population, and focus on testing those students in our population who are unvaccinated. So really focusing on high risk, our unvaccinated population, which is small among our students, and focusing on those who are symptomatic. And I think that that is wise, and that is where the CDC seems to be landing. And until there is a change and until we see numbers increasing, that's where we're going to be. And that's where we're landing at this point.
And close contacts?
Obviously, close contacts
Okay.
will be tested again on day 5 as would be the normal routine to test those.
All right, great. So I'm going to shift to operational questions for teaching or for working at William & Mary in the classroom. Professor Dolan, how are faculty going to accommodate students who have to isolate if they have COVID?
So I think the William & Mary faculty have the expertise to ensure that students stay on track and to collaborate with students to address their individual needs. Just last week, the provost emailed all faculty with resources and training from IT, as well as from the Studio for Teaching and Learning Innovation, so that students that are in quarantine and isolation can still get the material. I know earlier today, I clicked on that link and I signed up for a refresher Panopto training, just to hold the space to practice and be ready to use that tool in my big classroom. Additionally, the deans are giving advice to faculty to increase the consistency in the information we provide for students and to give more resources. In arts and sciences, there was a nice little paragraph that went out about a week ago that you could take and cut and paste and adapt and put right in your syllabus. So that was another tool I was able to use. In addition, we have the Path Forward that features a faculty guide that the Public Health Advisory Team helped work on. So we really do have a number of resources to support students and faculty who are quarantining or isolating. I do want to note that it's important that students are flexible and that they accommodate faculty who also might be out, whether they have a positive diagnosis or they're responsible for taking care of somebody with a positive diagnosis. In my big class, we talk a lot about creating a flexible learning environment, or a flexible learning culture is the term that I use. And we talk specifically about what it's going to mean if the student is out, and then likewise, what it's going to mean if I'm out, and how they can access material and where that's going to be located and what the shift is going to be. It really does require a level of adaptability and understanding for all aspects of the classroom.
It makes me really proud to hear that scene of teaching and to think about what it means that we are teaching being change ready as well as becoming change ready ourselves. 3 years ago, if you'd asked what industry in the nation was the slowest to change, I'm sure higher ed would have been right at the top of the list. And what we've shown is something that's surprising to many, many people and a real source of pride, which is we've made ourselves change ready in the service of our mission. I've never been in a place that's more committed to ensuring that students learn and that they stay on track to their degrees. And I know every faculty member has that at the front of mind. Every staff member has that at the front of mind as well. Amy, let me ask a question just about the practicalities of meals and transportation for isolating after a positive test. How are we handling that for students?
So maybe I'll start with talking about how we're handling isolation and then talk about the logistical support that goes around that. So as we announced last summer, we've asked each student to have a plan to isolate away from campus. Each student was asked to submit that through their personal information questionnaire. I'd suggest if students haven't looked at that recently, take a minute to go back and just refresh and make sure that you and your family understand what your plans are for this semester. The plan's important for students, whether they live on campus or off campus. But we recognize for those that live on campus, they may not be able to isolate away from campus, or may live far enough away that it's not easy for them to get home. So we will work with any student that doesn't have an option to be isolating off campus. We'll work with them to identify a hotel room in the local area. We have some great hotel partners that have really been in partnership with us and are anticipating we may see cases higher this semester than we had in previous semester, given the spread of Omicron. For students that end up needing to go to a local hotel as part of their isolation plan, we will provide transportation and we will provide meals for them as well while they're in the facility. We're looking at deliveries multiple times a week and also making sure that we have some meals on hand in the facility so that students, as they are bridging in and coming in, have access even if they haven't been able to order meals previously.
Okay. Maybe this is a time for me to give a shout out to all of the amazing human beings who have put together something like 55 pages of guidance and answers to questions, frequently asked questions. Our Path Forward website, Report COVID, and all of the other resources that we have out there. Thank you to all the IT folks, the staff who've made sure that's up to date as our community needs. Dr. Wells, let me turn to you and ask the really critical question. How are we going to have fun while keeping folks safe, students, faculty, and staff? How are we handling social activities, play, hanging out? Talk to us about that.
Well, I mean, our campus is open and we just have to really think about how we're going to do things safely. We have to be creative, which we know our William & Mary faculty and our students are probably some of the most creative people out there. And we just have to think about how we do things as safely as possible. We have to be smart and think about how we can do things outside when we can. Is food or drink really necessary? And is it really a critical part of the event? And if it is, how can we do it in the safest manner possible? So I do think that we want to continue to gather outside as much as possible. And when we can't, we will try to do things in the most socially distant manner that we possibly can do. We're continuing to have sporting events. We're doing these things safely. And we're sometimes putting off banquets and gatherings until the spring, if we can, when weather is nicer. And we're learning to be flexible. And I think you emphasized that earlier on. Flexibility is key, and but we're going to operate and open and continue to live our lives in this environment. So we're going to have fun, and we still are. Basketball games are exciting.
Yeah, they
still are. Yes.
I'm just going to keep stressing how important it is to be in community, to be in fellowship. One of the strains that we have seen increasing over the last 2 years is mental health pressures, the additional pressures that pandemic puts on an already intense experience of learning as deeply and as fast as William & Mary students do. And I want to encourage students, along with faculty and staff, to use the resources that are available to you and adopt our wellness practices daily. We have an extraordinary resource in our wellness office and online and our wellness ambassadors. So let's keep using them. Amy, a quick question about parents. There are students, faculty, and staff who are parents who may have, or those who may have high-risk family members or children who are too young to receive the vaccine. How do we support them? How should they think about being at work or being in the classroom?
So President Rowe, you know this is a personal question for me. I have a family member who's high risk. And so, this is one that we've been dealing with in my family since the beginning of the pandemic. But I think, for everyone, for faculty, they should be talking to their department chairs and deans to determine how they might modify their work in the short term while they're dealing with, other issues on the front. Likewise for staff and students. I mean, part of the reason we recognize for students that not everybody may be able to isolate at home is they may live 30 miles away from home, but they may live in an environment where they actually have a high-risk family member, and isolating in a hotel may be a better alternative for them. And then, for staff, same thing. Talk to your supervisors. Think about how you can shift your work. I think as teams, you had mentioned and touched on this a little bit previously, we should anticipate that there are going to be disruptions. And so as team members, we may be called on for a short period of time to step in if a colleague is out. I think that's really going to be our success as we go through. And as you said, flexibility is going to be really important in the coming weeks.
That's right. And it's not forever. We've got an intense surge going on now. But as we've seen in the past, it won't be forever. So flexibility for the near term is the watchword right now. Professor Dolan, what about faculty members who have students eating and drinking in the classroom, an issue that has periodically arisen? I want to address it directly. What can they do about that?
Yeah, so we get that question quite a bit, and setting a classroom policy for eating and drinking was something that we already had as part of our toolkit, even before March 2020 when the pandemic began. But absolutely, yes, it's part of the classroom plan that you can adopt, and the provost specifically clarified that last September.
Thanks. Amy, is public health emergency leave still available?
Yes, so the public health emergency leave was just renewed for the current leave year that began on January 10th. There are 40 hours available for full-time employees, and employees that work fewer than 40 hours, it's prorated based on their level of work. HR can provide you with additional information if you have questions.
Great. So for everybody who's asking about the dashboard, yes, now that we started testing again and we have data, we will put that up. As always, we caution people that that's only the data that we have. It's partial data, and the Williamsburg, James City County site with the regional COVID data is also a really good resource. So finally, I've got a question to all of you that I'd like you to weigh in on briefly, though. A number of people have looked ahead and said, what are our plans for future variants? How do we think about what we can expect? What are the proactive things that we can do, knowing that future variants are likely to come down the pike? Maybe let's go in this order. Carrie, Amy, Dr. Wells.
Yeah, so I'm part of pandemic preparedness at local levels, at national levels, and at global levels. And one thing that we have done at W&M has always been proactive. And that's really contributed to us being successful as we've navigated each of these waves. We're on the 5th wave now, and I expect for any future waves to build on these lessons that we've learned and continue using data and science to really have a proactive approach and inform our next steps.
Thanks.
I would just add, President Rowe, you mentioned that we were in the beginning phases of moving towards endemic. Clearly, we're at the start of that transition, but I think over time we will want to eventually roll our COVID response into our normal operations. It seems pretty clear that the COVID is going to be with us for a while, and making sure that this becomes part of the normal course. There may be future instances where we need to change masking policies if we're going through ebbs and flows of cases, even once we're past the current level of infection that we're seeing today.
I think one way to think about it is with COVID is to think about it in terms of weather events. Think about it in terms of the named storms that we deal with on an annual basis. We're now faced with Hurricane Omicron, which is causing us a brief period of adjustment. We're having to deal with absences and some downtime. People are missing work, are having to cover for each other. We're having periods of a slowdown in our economy, but things are adjusting. So it's important that we just prepare. We prepare by getting vaccinated. We wear a mask, and we're making all of the necessary arrangements and preparations to weather these storms. And that's how we have to think about COVID. I presume that in the future, we will have more variants, which will be other storms that will hit us, but we will be prepared for those in the future. And if we think about it in that way, I think we will have a more positive attitude about COVID, and we can continue to live our lives and make the appropriate adjustments.
So I'm going to add preparation to our watchwords for the semester: preparation with flexibility. And those two things together, let us stay open, let us stay learning and living and working in company with others, as it matters so much to do at William & Mary. COO Sebring, Professor Dolan, Dr. Wells, thanks so much for these thoughtful answers and great metaphors. And I'm thanking everybody else who's listening for tuning in and sending in your questions. I want to remind you that you can go to our path forward and read it all through again. And if you've got a COVID brain, as I often do, then it's great to know that there's a lot of accurate information there. It's likely to be more accurate and more timely and more up to date than things that you find out on social media or on the web about what William & Mary is doing. I also encourage you to email our healthytogether@williamandmary address with questions, because when we get your questions, we know what people are curious about. We can update the website and you can get answers from the right people. Till next time, stay well, everybody. Can't wait to see you.